Hello, everybody. This is Gary. Today is Thursday, June 4th, 2020. It is 3:16 p.m. Eastern Standard Time in the United States, in Rochester, New York. And this is my coping with schizophrenia entry for today. Um, I didn't make a video yesterday, and I don't think I made one before that. Maybe I did. Um, but my mental health is going pretty well. Um, cut myself shaving. Uh, my paranoia is at baseline. My hallucinations are at baseline. My depression and anxiety are at baseline, meaning they're all at their lowest point. What's normal for me. Um, I have an appointment with my psychiatrist on June 11th at 11 a.m. And for the first time in about 3 or 4 months, it's going to be an in-person visit. I asked for that because he's leaving. Uh, that is, my psychiatrist is leaving the clinic that I go to, so I will be getting a new psychiatrist. The reason he's leaving is because he is a resident, which means he's a doctor, he's a psychiatrist, and he can prescribe medications. But it also means he's got more training to do beyond being a resident. And so he's moving on to the next step in his training as a physician. And I'll probably get another uh, resident to be my psychiatrist, which means that person will be with me for about a year and then leave. Unless they give me a psychiatrist who's completed all their training and is not a resident, that's a possibility too. I'm not even exactly sure what's going on and how this is going to be handled. It's always hard to have to lose one psychiatrist and get another one. Right now, I don't have a psychotherapist. I haven't had one in, God, 4 or 5 years at least, if not longer. Um, I've just been going to the clinic that I go to. It's called Strong Ties in Rochester, New York. Um, and I haven't had a psychotherapist there for quite some time. And nobody's making me take on a therapist. Um, One of the interesting things my psychiatrist did is he put me back on Klonopin, but he did it in a very restrictive way, which I understand. Klonopin can be physically addictive. Um, a lot of people use it illegally as a recreational drug. They mix it with other drugs, that kind of thing. So my psychiatrist prescribed me, I think it's 3 pills per week, 6 pills at a time, and that's got to last me 2 weeks until the next time I see my psychiatrist, which, as I said, is on June 11th at 11 a.m. Um, and if I run out of Klonopin and end up at the psychiatric emergency room, that's the end of me taking Klonopin, because the whole point of me taking Klonopin is to avoid visits to the psychiatric emergency ward. Um, my other medications pretty much stay the same. I don't know if I ever mentioned this or not before, but I smoke heavily. Obviously, I've mentioned that before, but I also have an albuterol inhaler to help me breathe when I have shortness of breath. And I probably wouldn't have the shortness of breath if I didn't smoke cigarettes. And that's another thing that scares me about coronavirus is I'm a heavy smoker, and if my lungs ever got infected with the virus, I would be susceptible to pneumonia and death, because smoking really is a pre-existing medical condition. It's a habit that destroys your lungs over time and your heart and other parts of your body as well. So in that sense, I have a pre-existing condition. Coronavirus could really mess up my health, although that hasn't happened yet. I've never had any symptoms at all of coronavirus infection. And I'm doing my best to keep social distancing, but at the same time, go outside and stay busy. It's about 70 degrees outside in Rochester. It's sunny. It's nice and warm. Got the air conditioner on. So in that regards, everything's comfortable. I had enough money to pay all my bills yesterday. Yesterday, I paid the rent, internet, electricity, and cell phone bills. And I know a lot of people on worse situations that I'm in. But as far as my mental health goes, I'm not particularly paranoid, not particularly anxious, not particularly depressed, um, not having a whole lot of hallucinations. My hallucinations are always there to some extent, but most of the time I can just ignore them, and I think that's what's happening today. Um, Comment, like, share, subscribe, press the notification bell, and if you really want to help out my channel, share it on social media like Facebook and Twitter. And if you have any suggestions for a video topic you want me to do, leave it in the comment section.